Assalamualaikum and good day. My name is Siti Nur Fathiah Binti Sharuddin with matrix numbers S64302. I have completed my industrial training at Safa Media Enterprise, also known as Safa Clinic Kuala Terengganu, from 3rd August 2025 to 15 January 2026. Safa Media Enterprise, also known as Safa Clinic Kuala Terengganu, is the organisation where I complete my industrial training. The clinic was established in January 2022 by the Managing Director Dr. Shamim Shuhada Binti with the objective of providing quality and easily accessible primary healthcare services to the local community. Safa Clinic offers general medical service such as health consultations, minor treatments, vaccinations, and preventive care. Since its establishment, the clinic has gained the trust of patients from various backgrounds through professional medical service, friendly staff, and strong patient-centered care. In addition, the clinic also emphasizes community health awareness by educating the public on preventive care and healthy lifestyle practices. Safa Clinic operates in the primary healthcare industry, which is one of the fastest growing sector in Malaysia. As a private healthcare provider, the clinic focuses on delivering affordable, accessible, and high-quality medical services to the local community. The clinic is well equipped with consultation rooms, treatment rooms, pharmacy counters, and ultrasound scanning facilities. These facilities support daily clinical operations such as wound care, ear and nose treatment, outpatient procedures, and health screenings. In line with current industry trends, Safa Clinic actively use digital platforms such as TikTok, Facebook, and Instagram to educate the public with health awareness and promote clinic service. From a trainee's perspective, the clinic provides a positive learning environment by offering hands-on experience, direct guidance from medical officer, and exposure to healthcare marketing, patient communication, and digital content creation. Process that company to be improved. Slide explains the current process of staff tuition and work assignment at Safa Clinic Kuala Terengganu. Based on my observation during the industrial training period, the clinic currently applies a flexible work process due to the limited number of staff. Each staff member is often required to handle multiple tasks such as managing patient registration, assisting doctor during treatments, and dispensing medication. During peak hours or when staff members are on leave, industry trainees may also be required to support these tasks in order to ensure smooth clinic operations. However, this multitasking process can lead to physical fatigue, reduced focus, and lower work efficiency, especially when the number of patients increases. Although this process allows the clinic to continue operating effectively, it may affect work quality and staff productivity in the long run. Proposed process improvement and justification. This slide presents the proposed improvement to the staff tuition and work assignment process, as well as the reasons for selecting this improvement. It is proposed that Safa Clinic implements a more systematic process by clearly dividing staff responsibilities according to specific roles. For example, one staff member can be assigned to handle patient registration, another to assist doctor during treatment, and another to manage pharmacy and medication dispensing. In addition, increasing the number of staff is recommended to reduce excessive workload and allow each staff member to focus on their main responsibilities. This process improvement was selected because it can increase work efficiency, reduce fatigue among staff and trainees, and improve the overall quality of patient service. A clearer and more organized work process also helped create a more professional working environment within the clinic. This slide explains the current process of staff leave management at Safa Clinic. Based on observation, staff leave is usually managed on a case-by-case basis, especially for sick leave or emergency leave. In some situations, replacement staff are not arranged in advance, which can lead to staff shortage during clinic operation hours. When this happens, existing staff may need to take on additional tasks, and this can disrupt the clinic workflow and increase patient waiting time. This slide presents the proposed improvement to the staff leave management process and a justification for selecting this improvement. It is proposed that Safa Clinic implements a rotating leave schedule to ensure that there are sufficient staff available each day. In addition, backup or temporary replacement staff should be assigned whenever leave is approved. This improvement was selected because it helped maintain smooth clinic operation, reduce staff workload, and ensures that patient service are not affected despite manpower constraints. This slide explains the current digital marketing and social media management process at Safa Clinic. Currently, Safa Clinic uses social media platforms such as TikTok to share promotional videos and health awareness content. However, content posting is mostly done based on availability rather than a structured schedule. As a result, the quality and consistency of content may vary and content performance is not always evaluated using insight tools. This limits the clinic's ability to fully understand audience engagement and content effectiveness. This slide presents the proposed improvement to the digital marketing and social media management process and the justification for selecting this improvement. It is proposed that Safa Clinic implements a more plain digital marketing process by creating a content publishing schedule and improving content quality through clearer information and more engaging visuals. In addition, using social media insight tools allows the clinic to evaluate content performance and make improvement based on data. This process improvement was selected to strengthen the clinic's online presence, attract new patients, and increase public trust in the clinic professionalism. This slide highlights the strengths of Safa Clinic Kuala Terengganu. One of the key strengths of the clinic is its experienced and dedicated doctors and staff who deliver professional and high-quality healthcare services. The positive communication between staff and patients also help build trust and improve patient satisfaction. In addition, the clinic provides a clean, comfortable, and customer-friendly environment, making patients feel confident when receiving treatment. Another important strength is the clinic's active use of digital marketing, particularly through social media platforms such as TikTok. The health-related video content not only promotes the clinic service but also educates the public, allowing the clinic to reach a wider and younger audience. This slide explains the weaknesses identified in the SWOT analysis of Safa Clinic Kuala Terengganu. One of the main weaknesses is manpower constraints, especially during peak hour. This situation can lead to longer patient waiting time and affect the smoothness of clinic operations. From a digital marketing perspective, although Safa Clinic is active on social media, there are still limitations in terms of strategic planning and consistency in content publishing. This may cause uneven access to health information among the community. In addition, managing time between clinical responsibilities and marketing activities is also a challenge, as both areas require attention to maintain the clinic overall performance. This slide highlights the opportunities identified for Safa Clinic Kuala Terengganu. One of the main opportunities is expanding the clinic's influence through community health programs such as health talks, free health screenings, and disease awareness campaign. These activities can help increase public trust and enhance the clinic image as an organization that cares about public health. In addition, the rapid development of digital technology and the public's interest in social media provide opportunities for Safa Clinic to strengthen its digital marketing strategies. This includes collaborating with health influencers and producing more interactive and educational content. Furthermore, increasing awareness of the importance of healthcare opens opportunities for the clinic to introduce new treatment packages and health screening service that meets current community needs. This slide presents the threats identified for Safa Clinic Kuala Terengganu. One of the main threats is the strong competition from other private clinics in the area, which also provide similar healthcare services. Additionally, rapid technological change and evolving trends in digital marketing require the clinic to continuously adapt to remain effective in promoting its services. Economic factors such as rising costs of medicine, medical equipment, and daily operations can place pressure on the pricing of treatments offered by the clinic. Lastly, changing lifestyles and different level of health awareness among the community can influence the clinic's ability to attract new patients and retain existing ones. The conclusions: industrial training at Safa Clinic Kuala Terengganu provided invaluable experience in understanding healthcare operations, allowing me to gain technical skills such as social media management, video editing, and promotional content production, as well as soft skills including communication, teamwork, and discipline. Through observations during training, I identified areas for improvement such as staff distribution, leave management, and digital marketing strategies, which if implemented can enhance operational efficiency and strengthen the clinic's image. This experience highlighted the importance of marketing in healthcare and the interdependence of its departments, and it will serve as a solid foundation for my future career while enabling me to contribute ideas and energy to help organizations like Safa Clinic thrive. This slide highlights my involvement in outreach programs and the year-end gathering during my industrial training at Safa Clinic.